I am a working mom of 2 little boys, and I am privileged and lucky to have a stay-at-home husband. And I actually started working here when my first son was 7 weeks old. So preparing for going forward with going back to work on the earlier side, I did a lot of research looking into breastfeeding, and I knew I really wanted to do that. And I just didn't find a lot of support for someone in my situation, going back to work early, being a working mom. Every book I read was really geared towards a stay-at-home mom, and it was frustrating for me. I think a breastfeeding class is just really invaluable. I think it's a small amount of time and a small amount of money, and I think it's very important for both the husband and the wife to attend the class, because breastfeeding really is a team effort, and it's not something a woman can do on their own. And it's also something that most people think should just be simple and intuitive, and it does take a lot of mental preparation because it's extremely hard in the first 2 weeks. It's exhausting. It can be mind-numbing. You're sitting there for about 8 hours a day trying to breastfeed, but it takes about an hour at a time, 8 feedings in 24 hours, and it's, you know, hard to push through. But once you've gotten through the first couple of weeks, it's easy. The babies eat faster, and it's very nice. So I think the breastfeeding class gives so many tips, so many things to think about to really mentally prepare you and help you through the hard times. While in the hospital, I saw a lactation consultant, and a lactation consultant is usually a nurse or a nurse practitioner who has additional training and certification in helping breastfeeding women. And the nice thing in this area is we have lactation consultants in the hospital at Maple Grove Hospital, and we also have them at Oakdale ObGyn and connected to the peds clinics. The lactation consultant really can help you with planning feedings, how often we need to feed, looking at how the baby is latching onto your breast, the positions that you're holding the baby in, to really make sure that we're not having trauma to the nipple and the baby is getting the best, you know, milk production we can. So I went back, arrived here at Oakdale ObGyn with my breast pump on my arm, and, you know, I got started. And I think some of the things that worked really, really well for me was having, you know, getting really comfortable and used to that pump early on. I bought the Medela Freestyle, which is a pump that I actually could hook on to my bra and chart on the computer, wash, you know, blow dry my hair, put my makeup on, and get things done. But there's not enough hours in the day to just sit and hold a breast pump. And what I did was I kind of got my body ready for, you know, being a working mom and not being around a lot. So I breastfed my baby kind of the whole time on maternity leave. But every day after the first feeding of the day, when your hormone production is higher and you make more milk, I actually pumped for 10 minutes. And then my body got really used to having extra milk then, like I was feeding twins in the morning. So I put that milk in the freezer in bags with the labeled dates, and by the time I went back to work, I had a whole freezer full of milk. So when I was able to go back, even though it was early at 7 weeks, I had the confidence that my baby was home with plenty of milk for him. So for a typical office day at Oakdale, I usually work in the office from about 8 a.m. to 5 p.m. seeing patients, and then doing paperwork for an extra about half hour to hour afterwards. So I would get up in the morning about 5:30 or 6 and breastfeed my baby, and then hop in the shower, and when I got out, I'd hook up my pump and blow dry my hair and put my makeup on. And then, you know, grab breakfast and head out the door to start seeing patients. And it you know, again, I blocked my schedule to try to get breastfeeding and pumping in every 2 to 3 hours, but it didn't work. So then I would pump again at noon and over my lunch break and eat my lunch. And one of the nice things for me is that I would dress in blouses a lot, or just really simple shirts that I could lift up easily. I didn't wear dresses or anything complicated. And I would pump in a patient exam room, do my charts, answer phone calls, and then go back and see my patients at the end of the day, until the end of the day, when I would pump again, usually while doing paperwork before I went home. And then I would breastfeed my son at night at his standard times, and then do it all over again. And when I was on call for 24 hours at a time, I just pumped basically whenever I could fit it in, and that worked out well. I talked to them about everyone looking ahead into how they are going to be able to, you know, pump at work. And really by state law, their employer has to give them time and a place to pump. I feel like the must-have breastfeeding equipment is the breast pump, and really looking into your insurance, and most times your insurance will cover a very nice dual electric breast pump. And if you are going back to work full-time, having a hands-free one so you can multitask while you're pumping, I think is extremely important. I also used some breast pads that were called lily pads. They're a little silicone pad that actually prevented leaking and really looked very sleek underneath clothes. Lots of the standard breastfeeding pads are very bulky, and I didn't feel confident wearing at work. So I think that the Lily Pad brand breastfeeding pads are great. I also used just some Medela brand breastfeeding wipes that I could clean off my pump parts with at work, so I didn't have to go and wash them and dry them at work. And then I also, just the breastfeeding bags, obviously you need to store the milk and freeze that, and really label it with the date that it was pumped. If you are breastfeeding and pumping every 2 to 3 hours and you still don't have good milk production, that's not your fault. That's something that you can't control, and to not beat yourself up about it. And we're here to help you through that and make a decision if continuing breastfeeding is going to be the right thing for you.